What if the biggest threats to your health after 75 weren't dramatic at all? Not a shark attack, not a lightning strike, not even a major accident, but quiet problems, slowly building in the background while life feels completely normal. Many adults over 75 don't realize that some of the deadliest health conditions begin with symptoms so small they're easy to ignore. A little fatigue, a missed step, mild dehydration, trouble sleeping, slight memory changes, and by the time these problems become obvious, they can already be dangerous. The good news? Many of these risks can often be reduced with earlier awareness, healthier daily habits, and regular medical care. In today's video, we'll talk about 7 silent killers seniors should never ignore after age 75, and practical ways to help lower the risk. Let's begin. 1. Heart disease. Heart disease remains one of the leading health threats for older adults in the United States, and what makes it especially dangerous is that it doesn't always feel dramatic. Many seniors expect chest pain during a heart problem, but after 75, symptoms can be surprisingly subtle. Some people experience unusual fatigue, shortness of breath while walking, dizziness, nausea, swelling in the legs, or pressure in the chest that comes and goes. Others mistake the warning signs for just getting older. Over time, high blood pressure, high cholesterol, diabetes, smoking, chronic stress, and lack of movement can slowly damage blood vessels and the heart itself. The encouraging part is that even small lifestyle changes may help reduce risk. Regular walks, better sleep, less processed food, managing blood pressure, and staying socially connected can all support heart health. And one of the most important habits? Keeping regular appointments with your healthcare provider, even when you feel fine, because sometimes the heart whispers before it screams. 2. Stroke. A stroke can happen suddenly, but the risk often builds quietly for years. After 75, blood vessels naturally become less flexible, and conditions like high blood pressure or atrial fibrillation can increase the chance of a blocked or bleeding vessel in the brain. What makes strokes especially frightening is how quickly they can change a person's life. Speech, balance, memory, mobility, and independence can all be affected in minutes, but recognizing symptoms early can save brain function and sometimes even save lives. Remember the word fast. Face drooping, arm weakness, speech difficulty. Time to call emergency services. Some strokes also cause sudden confusion, severe headache, blurred vision, or trouble walking. Reducing stroke risk often starts with controlling blood pressure, staying active, taking medications as prescribed, managing diabetes, and avoiding smoking. And don't ignore small mini-strokes, also called TIAs. Even temporary symptoms deserve immediate medical attention. 3. Falls. Many people don't think of falls as a silent killer, but after 75, a single fall can lead to major complications. Hip fractures, head injuries, reduced mobility, infections, and long recovery periods can dramatically affect overall health. What's concerning is that fall risk often increases gradually. Slight balance problems, poor lighting at home, loose rugs, weak leg muscles, side effects from medications, vision changes. One small issue becomes another, until one bad moment changes everything. The good news is that falls are not always just part of aging. Strength training, balance exercises, proper footwear, eye exams, reviewing medications, and making the home safer can all make a big difference. Sometimes prevention starts with simple changes most people overlook every day. 4. Dehydration. As people age, the sense of thirst often becomes weaker. That means many older adults become dehydrated without realizing it. And dehydration after 75 can become serious very quickly. It may lead to confusion, dizziness, urinary tract infections, kidney problems, low blood pressure, or dangerous falls. Hot weather, certain medications, diarrhea, fever, or simply forgetting to drink enough water can all contribute. One challenge is that dehydration symptoms may look like something else. Fatigue, dry mouth, headaches, weakness, confusion, dark urine. Some seniors think they're just tired, when their body is actually running low on fluids. Drinking water consistently throughout the day, eating hydrating foods, and paying attention during illness or hot weather can help lower risk. And for some older adults, setting reminders to drink fluids can be surprisingly helpful. 5. Loneliness and social isolation. This one surprises many people. Loneliness is not simply an emotional issue. Research has shown that long-term social isolation may affect physical health too. After retirement, loss of loved ones, limited mobility, or hearing difficulties, some seniors slowly become disconnected from daily social life. Weeks become months. Phone calls become rare. Conversations become shorter. Over time, chronic loneliness has been linked to depression, sleep problems, memory decline, higher stress levels, and poorer overall health outcomes. Humans are social by nature, at every age. Staying connected through family visits, community groups, faith organizations, hobbies, volunteering, or even regular phone conversations may help support emotional and physical well-being. Sometimes, one meaningful conversation can improve more than people realize. 6. Pneumonia. Pneumonia becomes much more dangerous with age because the immune system often weakens over time. For seniors, even a common respiratory infection can develop into something serious. Symptoms may include coughing, fever, chest discomfort, fatigue, confusion, or shortness of breath. But in older adults, symptoms can sometimes appear milder or unusual at first. That delay can make treatment harder. Risk may increase with chronic illness, smoking history, swallowing problems, or reduced mobility. Prevention matters greatly here. Vaccinations, hand hygiene, staying physically active, managing chronic conditions, and seeking medical care early when symptoms worsen may help reduce complications. And after 75, waiting it out with breathing problems can sometimes be risky. 7. Diabetes complications. Diabetes itself is common, but after 75, the complications can become especially dangerous. Poor circulation, nerve damage, kidney disease, vision problems, infections, and slow wound healing may all develop gradually over time. One major concern is that blood sugar problems don't always feel obvious right away. Some seniors experience extreme thirst, blurry vision, fatigue, frequent urination, or unexplained weight loss. Others may feel almost no symptoms at all. Managing diabetes often requires consistency more than perfection. Healthy meals, medication management, routine checkups, foot care, movement, and monitoring blood sugar when advised can all play an important role. Small daily habits matter more than occasional dramatic efforts. Thank you for watching all the way to the end. Getting older comes with challenges, but it also comes with wisdom, experience, and the opportunity to take better care of yourself than ever before. The important thing is not to live in fear of these health risks, but to recognize them early, stay informed, and make small healthy choices consistently over time.